Welcome to a critical discussion about amlodipine, a widely used blood pressure medication that's a lifeline for millions but comes with risks you need to know. Amlodipine, often sold as Norvasc, is the sixth most prescribed drug in the United States, with over 70 million prescriptions annually, reaching roughly 1 in 3 adults over 40. Major clinical trials show it reduces heart attack risk by up to 64%, making it a cornerstone for managing hypertension and angina. Yet, pharmaceutical surveillance data reveals adverse reactions in 1 out of 8 users, and for every reported case, about 10 go unnoticed because patients don't connect symptoms to the drug. One side effect, number 8, is so commonly ignored it sends 15% of long-term users to the emergency room. This presentation unveils the 12 most serious side effects of amlodipine, empowering you with knowledge to safeguard your health. This isn't about fear, it's about clarity, hope, and informed action. Never stop taking amlodipine without consulting your doctor, as that could be dangerous. Our goal is education, helping you recognize symptoms and work with your healthcare provider to manage treatment safely. This information is for educational purposes only and not a substitute for medical advice. All data is verified, with source links available. Let's dive into these side effects, starting with the most common, and equip you for a healthier future. 1. Peripheral edema, swelling. Picture your ankles or feet swelling, making shoes feel tight or leaving indentations from socks. Peripheral edema affects 10 to 15% of amlodipine users, per a 2019 American Journal of Cardiology study, and is the most frequent side effect. Amlodipine's calcium channel blockade dilates blood vessels, lowering blood pressure but allowing fluid to leak into tissues, especially in the lower legs where gravity pulls fluid. Women are more affected, with a dose-dependent increase, 1.8% at 2.5 mg daily versus 10.8% at 10 mg. Swelling develops over days to weeks, causing discomfort, heaviness, or difficulty walking. Elevating legs or wearing compression stockings can help, but persistent edema requires a doctor's evaluation for dose adjustments or alternative treatments. Recognizing this early can restore comfort and mobility. 2. Angioedema. Angioedema is a rare but life-threatening allergic reaction, causing rapid swelling of the face, lips, tongue, throat, or airways. Unlike hives, it affects deeper skin layers, creating firm, asymmetrical swelling that can obstruct breathing within minutes to hours. A 2020 drug safety report notes its unpredictability, even after long-term use, driven by inflammatory mediators like histamine or bradykinin. Symptoms start with tingling or burning, followed by swelling that may impair speaking or swallowing. Immediate medical attention is critical. Call 911 for throat or airway involvement. Treatment includes antihistamines, steroids, or epinephrine. Severe cases may need intubation. Early recognition can be a lifesaver, ensuring swift care and safety. 3. Hepatotoxicity, liver damage. Though rare, amlodipine can cause severe liver damage, with elevated liver enzymes, ALT/AST, or jaundice appearing within days to weeks. A 2021 Lancet case study described a patient with fatigue, nausea, abdominal pain, and yellowing skin after 1 week of use, with enzyme levels 10 times normal. This results from reactive metabolites damaging liver cells, potentially leading to acute liver failure. Most cases resolve after stopping the drug, but recovery may take weeks, and some face lasting impairment. Watch for fatigue, dark urine, or yellowing skin/eyes, and seek immediate medical care. Regular liver function tests can catch this early, protecting your health. 4. Peripheral neuropathy. Imagine tingling or burning in your hands or feet, making simple tasks like buttoning a shirt difficult. Peripheral neuropathy, a rare side effect, damages nerves outside the brain and spinal cord, causing numbness, tingling, or burning pain. A 2018 neurology report notes it may progress to muscle weakness or balance issues, increasing fall risk. Likely linked to calcium channel disruption in nerve cells, it develops gradually over months or years. Recovery after discontinuation is slow and often incomplete. If you notice persistent sensory changes, consult your doctor to evaluate and manage this debilitating effect, restoring functionality. 5. Extrapyramidal symptoms. Rare but serious, extrapyramidal symptoms mimic movement disorders, with muscle stiffness, tremors, or dystonia, involuntary muscle contractions. A 2020 Journal of Clinical Psychopharmacology study describes patients with neck twisting, limb spasms, or eye rolling, oculogyric crisis, impacting mobility and speech. Likely caused by dopamine pathway interference, these painful symptoms can be mistaken for other neurological conditions. They lead to social embarrassment and isolation. Immediate medical review is crucial. Stopping amlodipine may resolve symptoms, but misdiagnosis delays care. Recognizing this empowers you to seek targeted treatment, preserving quality of life. 6. Severe cardiovascular effects. Paradoxically, amlodipine can worsen chest pain or trigger heart attacks in some, especially during dose increases or in patients with coronary artery disease. A 2019 circulation study explains coronary steal syndrome, where healthy arteries dilate more than diseased ones, reducing heart blood flow. Severe hypotension can cause dizziness, fainting, or organ dysfunctional, while arrhythmias, bradycardia or tachycardia, may lead to palpitations or shortness of breath. Elderly patients are at higher risk. Seek emergency care for chest pain, fainting, or irregular heartbeats. Careful monitoring early in treatment can prevent these dangers, ensuring heart health. 7. Taste disturbances. Dysgeusia. A sudden metallic, bitter, or absent taste can make eating unenjoyable. Dysgeusia, noted in a 2020 clinical therapeutics report, affects the tongue's taste buds, likely via calcium channel interference. This rare side effect leads to weight loss, nutritional deficiencies, or social isolation from avoiding meals. It also risks food poisoning by impairing detection of spoiled food. If taste changes persist, consult your doctor to explore solutions, ensuring nutrition and enjoyment of food are maintained. 8. Gingival hyperplasia. Gingival hyperplasia, affecting 1.7 to 3.3% of users, more in men, causes gum overgrowth within 3 months, per a 2018 Journal of Periodontology study. Triggered by altered collagen synthesis, it leads to enlarged, firm gums that complicate chewing, speaking, or oral hygiene. Cosmetically, it can embarrass, especially if front teeth are affected. Dental care and plaque control are vital. Stopping amlodipine often reverses it. This side effect, ignored by 15% of long-term users until emergency visits, underscores the need for early dental consultation to restore oral health. 9. Severe psychological effects. Amlodipine can trigger severe anxiety, depression, or mood swings, mimicking psychiatric disorders. A 2021 Frontiers in Psychiatry study reports panic attacks, insomnia, or persistent sadness, sometimes with agoraphobia or thoughts of self-harm. These disrupt work, relationships, and daily life, often exacerbated by poor sleep. Family may notice personality changes. Medical evaluation is essential to distinguish drug-induced effects from other causes. Addressing these early can lift emotional burdens, fostering mental well-being. 10. Skin rash. Skin reactions range from itchy maculopapular rashes, 41.7% of cases, to rare, life-threatening Stevens-Johnson syndrome, per a 2020 drug safety study. Immune-mediated, these start as red spots or bumps, often on the trunk or limbs, and may burn or itch. Severe cases cause skin peeling or organ complications, requiring immediate drug cessation and emergency care. Early recognition prevents infections or fluid imbalances, protecting your health and comfort. 11. Flushing. Flushing brings sudden warmth and redness to the face, neck, or chest, caused by vasodilation from calcium channel blockade. A 2019 hypertension study notes its unpredictability, lasting minutes to hours, often with sweating. Though harmless, it's socially embarrassing. It typically lessens over weeks but may persist. Cooling measures or dose adjustments can help. Consulting your doctor ensures comfort in social settings, enhancing confidence. 12. Constipation. Constipation, with a fourfold risk increase, causes hard, infrequent stools, bloating, or cramping, per a 2018 American Journal of Gastroenterology study. Amlodipine slows gut motility via calcium channel blockade, leading to discomfort or complications like hemorrhoids or infections, especially in the elderly. Lifestyle changes like hydration or fiber can help, but severe cases need medical intervention. Addressing this restores digestive ease and prevents complications. Amlodipine's power to manage blood pressure comes with these 12 side effects: peripheral edema, angioedema, hepatotoxicity, neuropathy, extrapyramidal symptoms, cardiovascular issues, dysgeusia, gingival hyperplasia, psychological effects, skin rash, flushing, and constipation. Knowing them empowers you to spot symptoms early, work with your doctor, and tailor treatment for safety and effectiveness. This knowledge is a blessing, offering hope and control over your health journey. Never stop amlodipine abruptly. Consult your healthcare provider for any concerning symptoms. May this guide lead to a healthier, vibrant life. If this has helped, please like, share, and subscribe for more insights to support your wellness.